The doctor is in. How are you guys?
Very good. How are you?
Doing all right.
Doing all right? I got my two buddies today, these brainiac women. I'm so excited. Hopefully they'll be here. But April is Minority Health Month, and we are in a minority health mess. So I called my two guru friends and said, let's talk about this.
Yes,
We can't be political because I'm a nonprofit.
right.
I'm going to try to, hold my tongue and not talk about say bad words. But I think we have a lot to talk about. So I have, my good friend Sheila Thorne, who's just a force in multicultural marketing for many pharmaceutical companies, bringing this Black voice to the table. And I met her years ago doing focus groups for Pfizer, where I was like the Black voice, and I heard this voice. I'm like, who is that? Who are you? Talk to me. Be my friend. And so she's been like, bam, hitting the,
And the rest is history. Yes.
never yet. And then my sweetie pie Shanta,
Oh, yes.
and Haley says she loves you more than I do, but whatever. I love you. Who is like in this space, trying to really help people get through cancer and like deal with all the disparities, all the financial issues, all the things, and just being this huge heart in our ecosystem that is just fighting the barriers, fighting to knock it down the walls to get people the care they want. So you guys, I don't even know where to start this conversation. I don't. And we've had most texting me. We've had, Minority Health Month for years. I don't really know what it means because we got all the things all the time. We over index for every disease in terms of mortality rates. In every disease, not just cancer, but heart disease and kidney disease and high blood pressure and all the things, diabetes. And so I don't even know where to start. I mean, I always start with cancer, but Mo's coming in a second. But it's just a really hard time right now. And
very difficult time.
Before we got in the air, Shanta was talking about the CDC layoffs, and I have so many friends who got laid off in DC from, Health and Human Services and from Department of Education. And, we had our, incredible Cory Booker doing his thing. And I was actually at a dinner last night with Angela Alsobrooks, Senator Angela Alsobrooks, and Senator Lisa, Lisa from Delaware, Lisa from Rochester, and they left the dinner to go be on the floor with Senator Cory Booker, which was awesome. But they're just still in the fight every day, and so I just say, God's in control,
Absolutely.
and these diseases aren't going to go away.
That's right. That's
People
right.
keep getting sick, no matter what color or what race, what politics you have, what all your, whatever your politics are, you're going to get sick. So
that's right.
I think we have to sort of weather our way through this. And it's so funny. Senator Alsobrooks said, you know what? This is a 4-term job. I have a 6-year job, 6-year term. So they can see beyond what's happening, and I think we just have to look beyond.
We do.
We go. Oz is over there, and we're going to get there by Friday, right?
So, well, Ricky, thank you for all that you do. Shanta has been a force. You're a force, and I think collectively, that's how we all have to, put ourselves together. Yeah. And when you graciously invited me to be a part of this program, I had to think back, because there were state minority health months long before there was a national.
Yeah.
And Ohio was one of the states that I first learned about that was doing the whole thing. And it was actually September for them. It wasn't even April.
Wow.
So there was a precursor to this. And I think that's part of what encourages folks like us to keep going. There are folks out there that really want to do the right thing.
Absolutely. And more importantly, what we're reflecting here is what is going to be needed to move us all forward. Exactly. And that is collaboration, and to a degree of intensity that we've never thought about before. So this is about coming back to community, because if we really think about the way communities of color have actually been able to achieve anything, is through collective intellect, collective power, collective strength, and collective movements.
No question about it, Shanta.
Right.
And community is what we as a people have always thrived upon. The general masses are difficult to penetrate. They often don't want us in the room with them. So we've just kind of gathered around ourselves and tried to do what we know is best from our neighbors to our family, blood relatives, non-blood relatives, people that look like us have got to be in the room together. And when this National Minority Health Month started, I remember sitting I was invited to a room with dear Dr. David Satcher when he was Surgeon General. And we were around the table and he had a bunch of files on the desk with Dusty. And he said, I think it's time we revive this. That was in 2002. And then it was called, National Negro Health Week, came from Booker T. Washington. I mean, you all know the history.
Yeah.
And he said, I think we better make this a little bit more inclusive. Everybody sat around. He goes, anybody want to take a shot? And so as many of you do, and as I have done in my years, I raised my little hand and I said, I'll try.
Right.
Pulled that stuff together, read it over a weekend, and came up with what we thought might be something to continue to raise awareness about what Ricky said is so prevalent and persistent and pervasive health disparities, and
Yeah.
not just about poverty. Okay?
Right.
We have
Yes.
insurance, we have money, still dying prematurely from preventable, treatable, manageable disease. So something else going on there. We figured that
Yeah.
out, didn't we? We know what's going on.
Yeah. Well, you know what? I learned this fact too recently from my soundbite project. Hey, Mo. Glad you.
Hey,
Hey,
Dr.
Dr.
I
Mo.
came in. Hi, everybody. I came
Mm.
right in the thick of it,
Yeah.
and I'm about to drop some grenades. So keep going, Chris. Ricky, what did you
Yeah.
learn from Standby?
So this is from Dr. Lauren at Emory. And she basically did some research and she found that Black women who have equal insurance, equal good health insurance,
Mhm.
still have a 66% higher mortality rate of breast cancer than white women.
Mhm.
What Black women who live in a high socioeconomic neighborhood
Yep.
still have a 126% higher mortality rate than the white women in the same neighborhood. So what does that say? It's not about money.
No,
It's not about
no.
maybe that Black woman in that white neighborhood is stressed out by her neighborhood,
Mhm.
whatever, but she's
Mhm.
still dying. So it's not about money,
No.
not necessarily about access to insurance or care. It's about the science. It's about
That's exactly.
differences in our bodies,
Mhm.
whether it's hereditary, whether it's genomics, whether it's our environments, but it's way bigger than just blaming, oh, they're poor.
Exactly. That whole social determinants began coming to the fore: education, health literacy,
Right.
systemic things,
Right.
makeup. I mean, there's such a constellation of factors that will impact outcomes. But you know what, sisters? Race is in the middle of all of it.
It is.
When you get care, if you get care, from whom you get care, and where you get care. That zip code better than the genetic code. So there's a lot of other stuff going on where it's easy to say money and insurance. That just dismisses
Yeah.
us. No, not it is a part of it, but that's not the main driver of these poor outcomes and premature deaths. It's just unconscionable. It's about time we stop that foolishness.
And I think these biological differences are not just in cancer.
Oh no.
It's got to be in cardiology. We're now working on this little project for cardio oncology, because we're now finding that Black women who have had breast cancer are more likely to get heart disease and vice versa.
Uh-huh.
What's that connection all about?
Exactly.
That's not happening with white women. You know what I mean? That's a whole nother science area. We also
And they're less likely to be referred for a cardio-oncology consult or to have a cardio-oncologist at their institution, though, Ricky. And the other part of it has to do with chemotherapy. More likely to have cardiac toxicity from chemotherapy.
from
That is
chemo. Well, I know
likely
I got from Adrienne Meissen.
not reversed,
Yes.
right? Because we
Yes.
talk HER2-directed therapies, we talk a lot about the reversible cardiac toxicity, but for Black women in particular, it's not necessarily reversible. I want to ask the question about really two things, because I hear us saying that this is a rallying cry for community. I mean, I feel like we thought that sort of around election time as well, depending on what your thoughts, what your beliefs, your political affiliations were, but we're not a monolith. And we're seeing that people, Black men in particular, you know, if the issue is Black health equity, maybe voted against their own self-interest with respect to some of the policies that are playing out right now, right? These policies are not going to improve the health of Black men.
Right.
About how do we help folks or navigate this needing to reach across the aisle, because it's no longer sort of just black and white party for party, right? Like it's different people's beliefs that are interspersed within their political affiliations. Like how do we both, one, educate the masses, and two, combat misinformation, right? Because right now is rampant. And the things that people believed 20 years ago about cancer and air hitting it, and biopsies and vaccines and lots of things are translating into misinformation even today. It's coming back around again. So I want us to talk a little bit about what are some strategies to both reach people, even if they don't necessarily share your political beliefs, and two, combating misinformation.
So I think, you know, I'll start with that. And I think that that is where science becomes critically important, because what you can't dispute is what science says, even the gaps that we know exist within science. And so I think we have to help people, like we always say, sift through the clutter. And so that's why those of us who know better, we need to be in rooms and in positions where we're challenging things that we know don't have any type of scientific backing at all. So we have to keep our eyes open and ask ourselves, why would there be such an attack on science? Right? And it's because we know that the science is there to really give us what we need so we can dispel misinformation. If you have no point of reference that you can go to that has been validated by some truly trustworthy source, then anything I tell you, you'll believe to be true. And so those of us who really have been in this space, and it's enough of us that's been in this space for a long time, when we hear foolishness, we need to be able to call it out, call a thing, and being able to direct and connect people with information from trustworthy entities that has been validated and is scientifically sound.
Exactly. No, right, Shanti, you're right on point, especially if you're in community and you can put the face that is trusted in the community. You put people of color, physicians, health practitioners, a variety, and make sure that they are part of that messenger group that is going to deliver and become a filter. Used to have a group where, well, you heard this on the news. Well, what that means is this, somebody of color. You know, so you really have to make people feel, look them in the eye and make sure that they understand. And you got to show up in community. It's not just social media, which is absolutely excellent to get people's attention. You got to be there. Too many of my pharma clients will give money, but they don't show up.
They don't show up.
So they're just, you're suspicious. Why aren't you there? Okay.
I think the same applies though, Sheila, for the doctors, right?
Absolutely.
Yeah.
Absolutely. Yes.
To expect people to come to us in the clinic, we have to meet the community where they are and build and bridge that trust. The onus is on us.
That's exactly right.
Broken by the healthcare community, it must be repaired by the healthcare community. But you're right. I put in the chat, nothing about us without us, right?
Nothing about us without us. That's
But
exactly
that's what even Val always says. Val always says, as cancer survivors, we need to walk this walk and talk this talk. That we owe it to our community, our other blesties, whatever, that we have to be this trusted voice. And so that's what we do every day. I mean, that's kind of the fundamentals of what we even do at Touch. But I know that, that's why I'm thankful for this platform. Thank you, Reggie Ware. Thank you, BlackDoctor.org, because we're going to give Reggie an award at our 5th anniversary.
Oh, great.
I love that.
Because he helped us have this way to reach people.
Yes.
We know, thank you for watching, listening, and hearing us every Wednesday, but we need these kinds of platforms to be able to talk about this stuff and make people aware with credible information. And it's something that I just value, the opportunity to be able to give the information that I know and share with what we know, so, but we need more of this, and we need to be able to okay, you know,
In non-traditional places, you know,
Yeah,
we
no,
know, we know
exactly,
the
in
church is the
non-traditional
right
place.
place, but
Yeah,
you know, I've gone to hair braiding stores, I've gone to nail salons, I've
yeah,
gone to bodegas, I've gone to,
right,
Food
as Dr. Moon
pantries.
said, meeting people where they are
right.
and not
Yes.
being afraid to go in community to make that happen. And that's an opportunity for us to get down on people's level. You don't dummy down stuff. You just be inclusive. You're around that kitchen
Right,
table in
right.
mama's
Yeah,
house, okay?
yeah, create a kitchen table wherever
Create
you
one.
go,
That's right.
wherever
That's
you
right.
go.
Table talk, as we
Yeah,
call it. So,
yeah, yeah,
and with men, I've gone to barbershops, as you know.
yeah,
Okay.
yeah,
I've done health screenings in front of automotive stores, you know, Pep Boys and AutoZone. Show up. They're gonna come to you. They're not too willing to do that, but
no,
you
you
go
gotta
to
do
them
that.
and and don't always make it about the disease. Put it involved with
Right.
something else so
It's
that
a
it
Now you
family.
becomes a
preaching, Sheila,
holistic
right?
approach.
That's what I tell the medical students, right? There's a person attached to this chart, to this diagnosis, and we
Yeah,
treat the patient, not the disease,
Exactly.
and even in the era of precision medicine, we cannot sacrifice, and we can't just treat the patient, we must also treat the disease. So I like to say we treat the patient and the disease,
right,
right? And
right,
so focusing on both of those things and
right.
making sure we take into consideration that patient journey, their ecosystem, their values, their beliefs. And I think that's from when stems a lot of the mistrust, is that there isn't always the acknowledgement of what do you value, what do you believe, that inclusive nature in our conversations about our health. It can really be a little bit paternalistic and preachy, and we're going to tell you why, for example, Ricky, why Black women get breast cancer because they don't breastfeed and they
Right,
obese,
don't even,
right? We had a doctor, a head of a major
a
institution,
black doctor.
a
Really?
head of a major national institution tell us that was why Black women got breast cancer.
What?
Because they don't
Yeah. So
breastfeed
so
in
what
their,
do you
right,
expect folks to do with that and believe with that? And how do you build and bridge trust with that? So
Let
that
their
brings up
right,
the question then, how do you source good information? And how do you
Yes.
advise other people to source good information? What does that process look like?
And it's also, I think, part of the challenge of healthcare professionals who don't understand community. We have to help them. And it's beyond being culturally competent, okay? It's having a cross-cultural education. It's not diversity training. I don't know how you get trained in diversity anyway, okay? But
hello,
it's diversity education. Why
right,
do we feel the way we do? It's not all about Tuskegee either, okay?
no,
Because many of us don't even know about Tuskegee. It's how we're
right,
treated yesterday when we went to the
Okay.
ED and we were
right,
dismissed and weren't listened to.
Precisely.
It's that whole history of dismissiveness and you're not
right,
valued, you're not important. We've got to
right,
you have to break down those barriers and make sure that people know you have a right to healthcare, quality healthcare. It's not a
yeah,
privilege. It's a civil right.
yeah,
You asked a question about sourcing information. Think about if you take a car to be repaired, you go in for that oil change. And so, on average, that oil change is about $35, $40. And they come out and they tell you, oh, your bill today is going to be $500 or $600. You're going to ask all kinds of questions
Oh, yeah, she will.
because of the fact you
right,
know what you came in for, but now they're telling you something different,
right,
and something within you immediately has a reaction to that, and your intellect follows shortly after that. So
Right.
when we hear these things and they just that don't sound right, question it and
right,
be okay with questioning it, but
right,
also being okay with, let me find out for myself.
Mhm.
right,
Yes, this
right,
is what it is you're saying.
let me
However,
ask you a
let me
question.
go to some of these resources. Let me go to the touches of the world. Let me ask some of these Black physician networks. You got organizations like NMA that are
Right,
well populated with Black physicians, or
Mhm.
you have the Hispanic Medical Association. So
Mhm.
you
right,
go to
right,
these
right,
places, but we have to do a better job in letting people know where they can go and actually get
good
accurate,
information,
vetted, good information in the way that they can understand.
That's
We
right.
we put everything in a brochure like everybody can read.
Mhm.
So we have
Mhm.
to start making sure that in our education and awareness efforts that they're multi-pronged. We may have print, but we might need to have some audio. For our Native American populations, we may have to have visual. In other populations, we may have to have visual. We need to understand more about how people like to receive information and
Yes.
how they actually digest information and
Mhm.
how they actually understand. Because many of us have been in a room where someone is smiling and nodding, and we think that they in agreement with us. We think they understand everything that we just said. All they did was smile and nod, because just like church, when the pastor say, you say amen, the faster you can get out of here, that's smiling and nodding. It's just my way of trying to get out of here. So we just have to make sure that we don't take this one-dimensional approach and how we give people information. And then collectively, we got to make sure that just because I tell somebody about touch doesn't mean that that makes PAF less valuable as a resource. So we have to be okay with
Yeah.
directing people to resources and information, even if it's outside of our organizations.
Yeah.
Exactly
Yeah.
right. That's exactly right.
And that's what we do. Like even our Black TBC Sanctuary website,
Mhm.
all we did was pull stuff. And it's funny because Emily was up all night last night because Facebook is about to take down all the Facebook Lives.
Yeah.
So a lot of our
All the past
content
videos too.
from the show.
Yeah.
So yeah, so we went and pulled all the videos and made our own videos and built our own, and we set up on that. So again, so let's take everything we have and make our own out of it. You know, build our own website, our own database, our own, because we can't let it be taken from us. You know.
No.
But you know, you said something really interesting before we came on the air, Sheila, about, because I was saying how we don't have any leadership.
Right.
We start thinking about what are these information sources? Where are the people in power? Who should we be listening to and thinking about? And I love what you said. You said, we are all our own leaders.
We are. In your circle, whomever you deal with on a day-to-day basis, or even if it's serendipitously when you're dealing with people, what voice do you have? As I was telling you, I had my mammogram 2 weeks ago, and there was a young Black woman in the waiting room with me, and I could tell she was visibly nervous. First time she'd had a mammogram. I reached out and I talked to her. And I said, I told her I had been there. This is, I have this every year, and I could tell she was it. So, I mean, even at that, I mean, we are our brothers and sisters keepers.
Yeah.
Okay?
I love that,
And
Sheila.
I
Absolutely.
reach out, and she settled down a little bit. I didn't see her once I left, but I said, hopefully I gave her some comfort. I told her about your show. I told her about the organizations, and I said, get the diagnosis. I said, I'm so proud of you for being here today.
Doing it.
She was 25, young. And I
Wow.
said, what made you come? And she said, my mom told me I should do it, and I've read a little bit about it. I said, well, good. It was a Saturday morning she was there.
Good for you.
So
Good
we
for
need
her.
to take advantage of that wherever we are with somebody of color. I do it with men too. I said, I got a mammogram. Have you had your prostate cancer test? Okay.
Come on.
Thank you.
know,
Thank you.
You got to get them involved. And I did a
Got it.
program years
Yeah.
ago, out there. It was called Checkmate. You check your mate, okay?
Yeah.
Whoever
Yeah.
that is.
Yes.
Yeah.
Yes.
You have to keep that in the family, and then you know that we care about each other. We've always cared about each other, but we just have to take the initiative proactively. Speak.
Yeah.
And if you don't like the answers from your doctor, get a new one. That's right.
Right.
Okay.
If you don't like the answers, get a new doctor.
That's it.
Don't take no for an answer.
Don't take no for an answer.
And don't let yourself be dismissed.
That's exactly, and women
Absolutely.
in general are often dismissed, but black women in particular.
Yeah.
You know, drama queens, too loud and too this and too
They're
that.
not in pain.
Okay.
They're not
And
in pain.
don't ignore that gut, because our gut
thank
has got us out of some very vital situations. So
Intuition.
don't ignore that. That was
No.
given as a gift.
That was
Trust.
given as a gift. That was
Know
given.
your body. Know your
Yeah.
body. You know when something's not right.
Yes.
Okay?
And
And
you-
even
and
if
you
it
know when
turns out
something's not
it's
right.
okay. Yeah, you got
And you
just
know when
gotta
something's not right of the people in your house. You know what I
That's
mean? You know when
exactly right. That's
it's not
exactly
feeling well
right.
in your house.
My mom was an emergency a department nurse until she passed. My sister was a pediatrics nurse. So it was kind of in our DNA, health screenings. That was just normal.
Yeah.
Not every family is that way. Share that information. And did you guys hear about the Black medical student that is rewriting medical books, putting illustrations of Black bodies in it? Did you hear about that?
I love
Mhm.
that.
Physicians are looking at only white bodies are in the illustrations. So if you get a
Yeah.
Black woman in your, we don't look, and dermatologists. So I mean, I don't get
Surgeons
eczema.
too.
My skin doesn't turn red for eczema. It's different. So you've got to help these
Yeah.
professionals
Dr.
learn.
Paris.
Yeah.
Mhm. At Yale,
Absolutely.
they're doing a plastic surgery book of women of color as well.
Love it.
Absolutely.
There were
Lots of
also
interesting
Dr.
connections.
Regina, she basically, we helped her. She did a photo shoot of all of her stuff. She kept shooting pictures so she could change all the pictures that she shows to patients about what
Excellent.
it's going to look like.
Got to see yourself.
And you want it because she
Absolutely.
got sick of showing white bodies.
That's it. That's it. Yeah.
Absolutely.
Yeah, so we got to do that.
We just got to remember, so leadership is not relegated to position, because one
Right.
of the things that is so critically important is that people are people before they are patients.
Mm. You're absolutely right.
And at some point, we're all going to be patients.
That's
Some
that's
better than
yes,
others,
that's
right?
right.
Mm-hmm.
Right. Yeah.
Or you're going to have a patient in your family.
Mhm. And it's even
Well-
difficult for us in healthcare. I mean, we have to stay on top of our stuff too.
got that right.
Reading and
Yeah.
getting other opinions. And if you don't know something,
Yeah.
to call. I call doctors all the time and say, help me with this. And they love to teach. So
Yeah.
you call and they'll give you information. You'll find out. And you ask those who are the leaders of the field and clearly have made all of the barriers. I remember doing a program on hypertension. They were doing clinical trials in South Africa. And when they came back, well, our bodies aren't the same as South Africans. We're running to McDonald's. They're running to the next village. Okay. So, I mean, you can't compare just because we're all of color. We're not monolithic, as Dr. Mo said. We're different. African, African-American, Dominican, and interracially. Don't even think about that.
Right,
Okay.
right,
Biracial.
right.
So,
Right.
I think ancestry is playing much more of a role
Yeah,
than we ever
huge
thought
role.
than
That's what
before. And
Samba
you
is all
know,
about.
the question that I have, or the thing that I think we also need to do is continue to challenge our leaders, our clinicians to adopt new ideologies, to grow, to not rest on their laurels as well. Because if we're always looking back at the data we learned and never
Mhm.
synthesizing the new stuff, we don't make any progress. And I
That's
see this
right.
in things like the cancer guidelines, right?
Mm.
More data is needed, insufficient evidence, because we're always looking retrospectively, and we weren't included in the retrospective studies.
Mhm.
And so I think, we end up gatekeeping antiquated things, but challenging our doctors to know that new data and to be
Yes.
up on these things. And, one of the great things about this platform is that we're always inviting doctors to come and share what's the latest on this, quadruple
Yeah.
negative breast
Yeah.
cancer. What's the latest on genomics? What's up with PIK3 pathway? Like, there's so much that happens on these platforms, and I think sharing them, but also, asking your doctor questions. And they
Yes.
don't like it. I'll be the first one to tell
They
you, right?
don't.
They don't like it when you ask questions because they're afraid they won't have enough time. They're
Mhm.
afraid you've got misinformation that they're going to have to spend hours undoing, and
Yeah.
and they're afraid that it's going to in some way diminish their superiority. Let's be honest, right?
That's
But
right.
you have got to ask your doctors questions.
Exactly.
Like
Yeah.
I said, you will question that mechanic all day before you spend one dime
It's
on
true.
that
Right.
repair that they've told you. So this you have to keep repaired as well. So we
Mhm.
have to take that same degree of intention. Help me understand why you are saying X.
That's right. That's
Right.
exactly
Help
right.
me understand it. I mean, if you think about it too, how many times do we go buy the shoes, the dress, and we take them back?
Yes, that's right.
Well, I don't want this. I changed my mind. Doesn't fit.
Mhm.
Whatever. We can do the same thing with your health. You can
Yeah.
say, I'm not feeling this.
Mhm, mhm.
I want to trade it out. Trade it in for something else, right?
That's exactly right.
Trade the current. So we have to just do all the things. But
And
Although
the
I
one
will
thing
say,
think-
I have to add a funny comment. You don't haggle with your hairdresser or your nail salon, right? So don't be that copay. Give us
That's
a break.
right.
right.
So I no look, we ain't gonna, like I said, it's when I come in for that oil change and then you tell me I need a whole new engine.
Yeah, exactly. Then you sit up and
Come
take
on with
notice,
that.
right?
Isn't that the truth, right? Well, what do I really need, right?
Right,
Do
right.
I
I
really
really
need those tires? And you just upset.
Exactly.
Mhm.
And
So
what do I
we
really need
okay, that's what
today?
I'm saying. We have a comfort with asking those kinds of questions. And that's something materialistic that is depreciating every single day.
That's
This
exactly right.
body, this temple is going to be with us for the lifetime. So we have to just
Mhm.
apply that same degree of help me understand what's going on with me so that I
Mhm.
can make the best decisions for me and
Right.
my health.
Right. Right.
And the theme for this National Minority Health Month is better health through better understanding. Okay, they have a theme every year. It says
I love it.
that's it
I
right
love it.
there.
Better
Okay.
health. I love that.
Better health through better understanding. And so clearly that's an individual decision and a choice. Take charge and control of your own health. Whatever you know about whatever disease or condition you might have, how is it playing out in your body? Okay, what are the symptoms? You know, what have you ignored that you should have paid more attention to and told your doctor about? And be very open with your physician. Tell her if you're taking medication, how do you feel when you take it? We can't get into a rote habit of just doing the same thing all the time. I had a friend that had hypertension and she had a patch. She was taking 2 antihypertensives and nitroglycerin all at the same time and never felt good. I said, there's something wrong with that. I
Right.
said, what is going on? And I said, do you mind if I would go with you to the doctor? I'd love to know why you're taking all this stuff and your pressure's not controlled. Well, I went, lovely doctor, file that thick on her. We went through each medication. By the time we left, she was on one pill. And I was not condescending to the doctor. She said, she's my sister. So every time she goes to the doctor now, he looks around the corner and says, is your sister with you again? So because I challenged her. She was too frightened to do it. But we sometimes you need an advocate with
What are
you.
we afraid of, you know?
That's it. Scared of bad news. We get so much bad news. We don't want to hear nothing else bad. But
Right.
clearly, with your early detection is the key, whatever it is.
Whatever it is, early detection is the key.
Whatever
I did the same thing with my mom too, Sheila, because she had like a bag full. She couldn't even fit it into one of those little medicine things.
Okay.
I'm like, what is all this stuff? And we cut it in half.
You see? Yeah.
Cut it in half, and yeah, and then also, how much does that cost? Like
Exactly.
she medicine because she's military, but like it's people are spending all this money,
That's right.
and it may not be the right thing for them. So, and that's question everything.
Everything.
And I
Everything.
love,
I think that goes
doing
back.
all of these.
I think that
So,
goes back to what Dr. Mo raised, though, in terms of making sure that your healthcare provider is current in the is aware and current on the current science. And we're
Exactly.
not just continuing to do things because, oh, you've been my patient for 10 years and this is kind of been your
Mhm.
treatment regimen for 10 years. And
Good
we're just
point.
going to stick with that.
Mm-hmm.
Mhm.
Mm-hmm.
Even though there may be something newer that's better.
yeah,
Mm-hmm.
yeah,
Mm-hmm.
yeah.
It doesn't have to be in a confrontational way, right? When you go
Right.
see your doctor, you can say, "Hey, doc, what's new with hypertension?
Mhm.
What you learning? What's coming down the pipe?
Right.
Right? Am I gonna be
Exactly.
able to come off of one of these? What's new in diabetes? What you
That's
hear?
right.
What you learn? What's
That's right.
going on?" Right now, somebody, Zarina, put in the chat, and I agree with you. Healthy eating helps, and
Nutrition.
about
Mhm.
nutrition 9 times out of 10, maybe 8 times out of 10, you're going to get something like, well, read the labels and count calories. And so, there's the conversation that needs to be had among healthcare professionals as well, that if we didn't learn it, it doesn't exist, right? Because that breaks the trust. So if somebody
Yes.
says, "Doc, how can I do it naturally?" Right? You
Yes.
can't dismiss
Yes.
that.
You
You
can.
have to, we have to,
Right.
I think, return to,
Right.
talking with on what they believe is food is medicine, right? Because that's founded in something. And
Exactly.
we have a question: does your med ever get reduced? Right? Do meds ever get reduced? It's sort of like Walmart rolling back prices. Do they ever roll back to zero? Right? And so it's a two-way street there. To Lynn in the chat who asked that question. But how do you talk to your doctor about de-escalation therapy and about coming off meds? What are some tips and strategies for people who are watching maybe?
Yes.
And
Yes.
we've been talking about that with cancer too. Just the dosing, is the dosage right for me? Do I need all this chemo? Do I need all this stuff? Like having those conversations. That's so important.
So
And we
I'll
have,
start.
go
I'm
ahead,
sorry,
go
Ricky.
ahead,
I'll
go
start with that
ahead.
question. So I actually asked that question. So my mom has progressive multiple sclerosis, and so she was on a therapy for a really, really long time. It was an IV steroid. And so I remember just going to her neurologist and saying, "Hey, doc, she's been on this for a really long time. Is it still having the same degree of effectiveness that you thought?"
Yeah.
And he said, "Well, you know what? Actually, it's not. She's kind of reached a
Great
point
question.
where she has maximized on the effectiveness of this therapy." And so, as Dr. Mo mentioned, it wasn't in a confrontational way. It was like, "Hey,
Sure.
let's kind
Sure.
of look at these meds." And she's been on some of these for a while. Are we
Yeah.
still achieving what you've envisioned for her care
You
with this
see?
current regimen? And it opened the door for a conversation. And
Wow.
as a result of that, guess what? It was one less medication. And with that medication being removed, there hasn't been any adverse um reaction or anything for her, but it was just a simple conversation. And because, let's be honest, 15 minutes is not a whole lot of time.
Right.
And our healthcare providers don't they don't have the time to do the ideal prep that we might want them to do. They may just get a chance to kind of look at all of your therapeutics
Yes.
right during that appointment. So raise that, because that's an
Yeah.
opportunity for you to really be actively engaged as a co-partner in your
Mhm.
own healthcare by
Mhm.
raising these conversations, because that also tells that healthcare provider that you are aware and that you're paying attention and that you're just as invested in your
Mhm.
own health or the healthcare of the person you're caring for as they are.
Yeah,
Yeah, treating that whole person. You've
yeah,
got to understand what else are you doing
right,
to take
right,
care of this condition that you may be a little hesitant to share with your doctor, because you might think he or she would say, well, that's ignorant. You know, you don't want to do those herbs and teas. That's not going to do anything. But they need to know because of maybe interacting with your medication in a negative way. So, be forthcoming, and doctors need more help on nutrition advice as well. Culturally, Asians tend to be smaller in stature, so many of them are afraid of high dose medicines. And so they may break the pill in half, but not tell the doctor. And that
right,
impacts efficacy. So
right.
there's a plethora of things that if your physician is observant and astute, and if he or she is not, then you make them that way. Why is
Yeah,
this
ask the
happening to me?
question.
Yeah,
Yeah.
ask
And then-
questions.
yeah.
Yeah.
I know I had the same conversation with my mom this morning because my mom, her allergies are bothering her. And she said, no, Ricky, I've been taking the same allergy medicine for 20 years. So is it not working? Like, why do I have a headache?
There you go.
So I said, well, call the doctor. Let's talk about it. I have to read a comment from Carlita, our friend Carlita from Komen. Carlita. She said, uplifting each other is essential to amplifying the messaging and building trust.
Indeed.
We were talking about a little while ago that the message has to come from a voice of trust, and we have to help each other out.
We really do. And be prepared to do that and not intimidated or overwhelmed by so-called educated people that we feel as if we have nothing to contribute, but you do. You
Yeah.
know your body, and you need to talk about that so that people can learn. And that's how science becomes good science. It's not about race, it's about good science.
Science.
You need to know how these things affect our bodies. And environmentally, there's so much that comes in on us. We have no idea the food we're eating unless you have a garden in your backyard and you grow your own vegetables. You just eat. But who knows what's put on those things
Right,
and the
right.
water, all of
Right.
that stuff. And so
Yeah.
Sheila, you
it's a
mentioned
job.
something just now. I heard you say it, and you kind of slipped it in there under the radar a little bit. But you said, we have to talk about these things and we have to share and tell what's going on.
Yes,
Right. And I think that this is a good month to talk about that. Maybe
yes.
let's kind of dig into why people feel ashamed to share their medical history and how do we start to destigmatize some of that? Because a lot of what is happening in families, especially in a hereditary fashion, and some of these familial diseases, it's because we're not sharing this information and talking about it in our own families, right?
We're not. And a lot of what I find, Dr. Mo, is that we feel that if there is something wrong with us, that's a personality flaw. That's something wrong with you. It's your fault that you have hypertension or diabetes, and we don't really see that it may be something organic that's wrong with you, or maybe familial that may be wrong with you if you're eating right and exercising. So I think we have to be able to make sure that we know sickness is not a curse. Sickness is not a punishment for something you did wrong, as some cultures might think. But we have to understand that biologically, some things go wrong sometimes, and you may not be in control of it because of family history. Bring it up, share, talk. And if you're wrong, say, you know what, we got to check that out. I'm not sure that that's quite the right thing. I remember doing a focus group, and we asked the woman, she had very high blood pressure. And he says, why do you think that's happening now? Because she said she never took medication. Doctor never died. Why now? She sat for a minute. She goes, that's that no count son of mine that won't get a job and he's wearing my last nerve. So, I mean, it was stress.
That's
It was
stress,
stress.
that's
She goes, I
right.
get him out of the house, my pressure will go down. So you never know what those things are. How do you manage that stress? And as people of color, our stress is pervasive. I mean, every day, just being Black in America or being of color. One of my good psychiatrist friends said that many people of color are walking around with PTSD who's never been on a battlefield,
Okay.
just living, existing at work, at school, in the
Yeah.
community. We're dealing with do you fight this battle or do you keep your mouth shut? You know what I mean? We're constantly making choices about how to live peacefully. And yet when it is an issue, how to stand on principle. That's stressful. if you have to do that every day. And if you have a sickness on top of that,
Right,
Lord, it's not
Right.
easy.
right. We got Daphne in the comment saying, we don't share because we're ashamed.
Yeah.
So what are we ashamed of? Mo's asking, what are we ashamed of, sweetie? What are we
Mhm.
ashamed of? Like, what are we ashamed of?
And anybody can answer, but because I agree, I
Anybody,
think
yeah.
we
What are
do.
we
We have
ashamed of?
fear and shame.
Fear and
I think in
shame.
my family, we were afraid and ashamed because we didn't have enough money and we didn't have enough
Mm.
medical knowledge. If we couldn't quite explain it and we couldn't afford it, then we didn't talk about it, right?
Yeah,
The two
that's a
things we
good
probably
point.
needed to talk about most, money and health, were the two things we talked about least
Mhm.
because we knew the least about them. But I don't know if that's for everybody. I think maybe people feel like, you know, I don't know. So I would love to
Yeah. to dig into that.
also said the medical stereotypes, right?
Yeah.
Cause many not to dispel. So what are some medical stereotypes that we could dispel? You know,
Mhm.
even right now, what are some of the things, some of the stereotypes?
Oh,
Well, I
that obese people
yeah.
are lazy.
Indeed. And that's
Mhm.
even if they even like the word obese, because I've done programs in Harlem where women say, I'm not obese. This is the way my man likes me. You know,
Right,
this is the cultural
Right,
beauty as far as I'm
right.
concerned. So defining terms also, we have to be careful about using certain terms that people feel label them, marginalize them, and
right.
make it like it. Yeah.
I think
So,
that's a really, really big one. The whole obese word is a
Mhm.
oh
horrible.
yeah, you get that all the
Yeah.
time, right?
Okay.
And so it's not until now we're beginning to even have conversations about the science of obesity.
Mhm.
Because
Right.
it's always been framed as if it's a behavioral consequence of something that
Exactly. You
someone
eat too
did not
much.
do or did do.
Mhm.
Either
Mhm.
you did not exercise or
Right.
you ate all the wrong things and
There's
you
a
ate
blame.
them
It's a
in,
blame.
Blame.
yeah, so
Yeah.
it's that narrative. I
Yeah.
think the question becomes within our own family, though, why aren't we having these conversations? So, what is preventing us from talking about these things in our families? Because, we keep wanting to ask people about their family history, but we're making the assumption that people know those histories, right?
That's true.
They don't, because just historically, especially in Black families, it is we were almost like the military. Don't ask, don't tell, right? So we
Right.
we weren't talking about things. We know Big Mama had something. We know
Mhm.
Uncle Joe died from something. We know
Mhm.
Auntie Lucy did this. Let's call a thing
Yeah.
Yeah.
so that we can begin to understand what
Mhm.
may be present in our families. And so we're asking individuals when they come into the healthcare system to talk about their family history. Unfortunately, some are being very honest when they say they don't know it.
They don't
That's
know.
right.
They don't
That's
know.
right.
And it's like they're hidden, they're hiding something. But even my grandmother, I mean, I asked my grandmother like she's been dead years ago, but she said, you could lose your job.
Mhm.
If
Mhm.
somebody found
Mhm.
out you had cancer, you could get fired, or you could
Mhm.
lose your status, or you could lose your friends. Like people didn't want to be around you. It was almost like leprosy.
Yes. Yes.
And that was years ago, but like, you didn't want anyone to know your business
You don't
because
want. That's right.
it impacts your relationships, your job,
That's
right?
right. That's
Or you
right.
didn't want to bring shame to the family.
That's
Bring shame
exactly
to the
right.
family, right?
That's
Oh no,
We
does
see that
everybody
a
get
lot in
it?
lower middle income countries for
Yeah,
sure, that they don't
yeah,
want to bring shame. Even like I do a
That's
lot of
right.
work in the Middle East now, Saudi Arabia and others, like they're not eligible for marriage if you have breast cancer, so they don't
Uh-huh.
talk
There you
about it.
go.
Right.
You
There you
can't have
go.
children because you had chemotherapy and you are
yeah.
Uh-huh.
able. Now that's shame on your family.
Yes.
Yeah.
I think also of being needy, right?
Mm.
We don't
Mhm.
want to be a
We don't want to be a burden. We don't want to be a burden. We're
That's
seeing
exactly right.
force, a sign of weakness to
that
admit that
God is
something
Yes.
angry with you.
something.
God
Yes.
is angry with you, and sickness is a curse.
That's right. And
Mhm.
this whole myth of superwoman, okay? You can do everything. So you can't admit that you're sick because that shows there's a weakness there. You got to take care of you, your kids, your elderly relatives, your non-blood relatives. So you can't show weakness, and sickness is weakness. There's something wrong with you if you got that. Something you
Right.
didn't do. And that's
Especially if you're a single mom
if you're a
or
single mom, yeah.
managing the household, you don't want to show that you can't take care of your kids.
That's right. That's right. And cancer especially talks about that was a death sentence so many years,
Yes.
Oh my gosh,
Well,
it
don't want
still is.
nobody to know
Still
that. And
is.
if you do have surgery, you open you up, it's gonna spread. Let air
Yes.
get to it. Okay. All
Yes.
kinds of things were happening. So people didn't get care because, well, that's it. That's just God's will. I just gotta let it happen. Well, maybe it's God's will because we're talking about this. You need to check it out. Okay.
Right.
So
Right. God gave you the gifts of doctors.
that's right.
Faith without works is dead.
That's right. That's
What are you
right.
gonna do with your, use your faith?
That's
Use the
right.
tools
And
that God has given you,
one doctor I worked with used to use that. He came back, this lady kept having a recurring infection. He says, well, I guess I'm just gonna have to live with it. Well, why do you have to live with it? It's God's curse. Well, obviously God brought you here to me today, so he wants you to try something new.
Right,
Okay?
right.
I think, as we talk about, here we are, Minority Health Month, here's an opportunity for us to change and do different,
Yeah.
right? Because our health is a part of our understanding. So for everyone that is present, who's watching, make a vow to yourself and that your family that you'll initiate these conversations.
Good
So we
idea.
talked
That'd be
about
the clear-
leadership.
Yeah.
Each of us has an opportunity to lead, because
Yeah.
leadership is really about influence. So each of
Mm.
us has somebody that we influence. So this April, let's strike up these conversations as we
Yes.
get ready to get into Mother's Day and the family
Mhm.
reunion season.
Yes.
Instead of talking about, all our wonderful shows like Real Housewives, whatever city they in, let's talk about the family. Let's talk about our family business. Let's
Yeah.
have an understanding of our family business,
Mm-hmm.
because we have children and grandchildren that are relying on us. And
Mhm.
so it's time for us to take our conversations off mute and
Yes.
really have these intentional conversations about the health of our family, because future
Mhm.
generations
Mhm.
are relying on us.
No
So
question
when we
Yeah.
talk
about it.
about community, there's no other community like family.
No.
In your
Oh,
house,
no.
it's in your house. It's in
Health is wealth. As we
Health is
strive
wealth.
to make money, we strive to get better educated. We've
Right.
done increasingly well. The achievements of people of color are phenomenal in spite of all the barriers. But is that when you die from a stroke at 40, what happened to all that work? Okay. So you want to be around a long time. So
Right.
health, without health, you can't do any of that. You can't enjoy any of the fruits of your labor or your family and enjoying your family. That's what I use sometimes in talking to men. A husband brought his wife and his child to a screening, and he wasn't being screened. He said, no, I'll just let her do that. I'm going fishing. I said, no, don't you want to see her graduate from high school or walk her down the aisle when she gets married? Come on, you need to come in here and get screened. He finally
Right.
came in. Just, you don't think it's about you. Take charge of your health. Self-care,
Yes.
self-love. There's nothing wrong with that.
Yeah.
So you want to be there to
Yeah.
benefit yourself and your family.
Don't wait till you're in a crisis. I say, I do this thing at my church, like, be the CEO of your own health.
There you go.
You have your family's health. Do what you got to do, and this is what I do at Thanksgiving, and or really at every holiday. You know how Thanksgiving, everybody, you sit in a circle, you say grace. Everybody talks about what they're thankful for. I'm like, okay, well, tell me your numbers. What's your A1C? What's your blood pressure? When was
Yep.
your last mammogram? When, and I make everybody fess up. They hated me at first, but damn it, and I got their little cheat sheet. But I had to force the conversation,
You have to.
and
Yeah.
it turned out, no, Grandpa, you don't have pre-diabetes. You have diabetes.
Okay.
And
Yes,
you definitely
I'm-
don't have sugar.
Yeah, there
and
you
don't
go.
have the
Touch the
sugar, right.
sugar.
Yeah, yes, Aunt Sharon.
Thank you.
Smoking one pack a day is not a good thing, because you went down from 2. Like, all the things came out in the wash, but
Mhm.
to force the conversation, and it was painful. And now it's like, okay, what? Now it becomes something that is an expectation that you're going to hold people accountable and make them talk.
I think one of the other things we hadn't quite touched on specifically is mental health,
Mm.
right? Because
good one.
as we think, so shall we be. So are we. And when we know that when our bodies are under duress, right, they misbehave. Our metabolism is out of whack. We have and somebody said, putting in the chat, there's a history of gossip and maybe negativity in families that makes people not want to open up about what's going on in their families. And that speaks to the mental health in our community. So I think, destigmatizing that also can maybe help to encourage these sort of shared dialogues as well.
Yes, indeed. Yes, indeed. Yeah,
Yeah,
that mental piece is key. And obviously, people think that there's really something wrong with you. I'm not crazy, is the first thing they say if there's some kind of disorder. And that's unfortunate, because that's not what that means. You can get help. And we talk about this health equity all the time. And during this month, we're striving for health equity. And if you don't eliminate disparities, you're never going to get to the equity. So it's a constant journey. It's a constant being aware and conscious of who you are and what you're entitled to. And if we're all going to live for our best health, we got to have education. We got to understand. There's a lot we don't know, but there's a whole lot we do know that we could act upon. So taking action proactively in advance without getting ill, and eating right, moderating exercise, no smoking, limiting alcohol intake, or no, all of those things play into your health. And if you do it well when you're young, it won't hit you when you're old. I mean, but if we are trying to really improve our health, it's a day-to-day challenge. Whatever you eat, whatever you think, and as Dr. Mo said, when you think, and so you are. So keeping a positive
And you
attitude.
eat, and so you are.
Yeah, there you
You
are.
know how I define health equity, Sheila? Health equity, we're not going to get to it until we practice the golden rule.
Amen.
Everybody
I
said,
agree.
I'm going to treat you like family. I'm going to
Yeah.
treat you like I want to be treated.
That's
Everybody,
right.
from
Everybody.
people to nurses to family members, think about how do you want to be treated? And
That's
we
right.
you go back to that doctor and say, is this what you would give your mama, your auntie, your grandma?
Okay.
And I also believe that our lack of knowledge is breeding health inequity.
Exactly. No question.
That we have to learn and embrace and learn and grab and take all the information we can so we can level that playing field and challenge the ecosystem, challenge the doctors. So
Exactly.
we
Yeah.
gotta treat each other like we love each other,
Yeah. Yeah.
even if you don't, you know.
Mhm, mhm.
I had a friend who said, I'm gonna stop, I stopped drinking tequila. I traded it for Riesling. I'm like, I
Okay.
said, that is not really a thing, but if you believe, but I mean, but in his mind,
Yeah. Yeah.
he believed that was the right thing to do.
Mhm,
Trade
mhm,
tequila for Riesling.
And
mhm.
sadly, tequila probably has less calories, but that's
That's
not
probably
here.
true. That's right.
There.
But that was
It has
like,
least
I mean,
calories of all,
in his
and the least
mind,
sugar.
he was doing a really good thing.
Wow.
Yep,
Wow.
So,
Well,
but I
thinking-
think, but Dr. Mo, I think you're right. I think we have to destigmatize the conversation around mental
Yeah.
health and mental wellness.
Mhm.
It's real. Not
It's very
everybody is
real.
happy-go-lucky every single day.
That's
No.
right.
And just because there are moments when you experience feelings of depression or anxiety or things of that nature, that does not mean that there is something wrong with you,
That's right.
that you should ostracize yourself and
Right.
not take the same approach you would take about everything else that we're talking about.
Mhm,
Your mental wellness is just as much a part of your overall health as everything else. And so
mhm.
we just have to stop in our community stigmatizing individuals if they are having these feelings of anxiety or depression or schizophrenia or all of these other things that we know are present, because when we do that, it prevents people from seeking out the help they need.
That's
And it
right.
also hinders people's willingness to tap into the social supports that we
Mhm.
all need in order to thrive. And so it's
Mhm.
just critically important that we have these conversations around mental wellness and help people tap into the resources that they need.
That's
And the
exactly right.
resources aren't self-medication like
No.
tequila or weed
Right.
or whatever you think you're doing. You know what I mean?
Exactly.
The thing is, you know, we put a lot of pressure on our communities to adopt one way or nothing, right? And I think
Right.
in 2025, I really want us to learn that we can both rely on our faith as a source of mental health support and also rely on a therapist, right?
Right.
It's
And
okay.
choose to observe holistic practices and also adopt Western medicine and chemotherapy. Like we don't have to pick either or anymore.
That's right.
And
Right.
those things is something, if we could do a better job of integrating the things that you believe with the things that we know to be true, and
Mhm.
not that they're in contradistinction, they're not in opposition,
That's
but they
right.
can work together.
Mhm.
You know, like I think that's where people are going to find some common ground, because there's a lot of folks who are like, I don't want that vaccine, I don't want that this, I don't want that drug, I don't want that whatever.
Yes.
But
Yes.
understanding that these medications can be a bridge to wellness while you are yet working
That's
out,
right.
exercising, getting your therapy, praying, meditating, whatever it is that you're doing, we
Mhm.
can keep you from stroking out, and we can bridge you, like it, you know what I mean? And
Exactly.
I want that conversation to happen more often in our community.
Absolutely.
And
Those are the
culturally,
conversations that can be happening around the kitchen table. And
yes,
I think before you said someone, made the comment about, what if your family is just not that family because it's not a healthy environment and things of
Right.
that nature. And I get that. Trust me, I
Yeah.
get that. But
Yeah.
let's understand one thing. Cancer doesn't care about any of that.
Cancer doesn't.
And
True.
so these conversations are about life-changing conversation.
Yes.
And these are the conversations that we need to have so
Mhm.
that if we do have a family of history of something, it helps to inform our understanding and the actions that we take so that we can be proactive in
Mm.
our own health. So I just ask that we allow ourselves to seek out that mental wholeness we need so
Mhm.
that we can overcome those traumas that we may have experienced within our families so that we can have access to the information that we need to improve our overall physical health. So
Yes.
it is both. It's the physical health relation and the mental health relationship. So just
Mhm.
understand that at the end of the day, it's okay to be selfish because you're having these conversations so that you can pursue the path toward health that's best for you.
Yes, and sometimes it's a combination of medication and talk. You may have to do both, depending upon what the condition might be. And from a cultural perspective, we seek a lot of alternative ways of dealing with stress: music, dance, aromatherapy. I work with two Black psychiatrists. Well, that was a big part of what they did in trying to find the way to really get at what was troubling the person, that generational trauma that we have, a familial trauma that we have with abusive or dysfunctional family members. I mean, that's stuff that we live with. And unfortunately, we have to deal with that. Sometimes we bury it because we don't know how to deal with it, but it acts out in other ways, whether violence or self punishment or, self-inflicting. So that mind is so important in terms of keeping that, talking about it.
Yeah. Gosh, we talked about a lot of things. And I was wondering what we were going to talk about. Well,
Always
Well, the
something.
awareness, I think, I love
Mhm.
meeting with people who are in the field because you deal with such a variety of people with so many areas that need help. You've got to prioritize where you're going to go first. What are you going to have to treat? Do you treat the mind first before the body? Or do you do both together? I mean, a physician has a challenge in terms of what's going to work. If I'm clinically depressed, am I going to really take care of my cancer and go to my treatments and take my medication? You may not. So there needs to be some kind of collaborative effort, that coordinated care philosophy that we talk
Right.
about.
The whole body, the
The
whole
whole body,
the whole
yeah,
body, the whole being, the
that's
whole,
right.
and it's the family too,
It's a
like
family too.
everybody
Yeah.
gets the cancer, not just the person, not just the cancer patient. It's like
That's right.
everybody's affected. And that's where even a lot of the mental health comes in.
Let's
People-
ask this question.
Yeah.
As we do kind of a wrap up, because we talked about a lot of things and everything and specific things. Like, what are some key things that people can do today, tomorrow? What are some takeaways for this month and things that people could implement to start
Yeah.
being the change they want to see? Let's
And
do a
I'm gonna put
round.
'em- and I'll put them in the comments.
Yeah.
So I'll start.
Okay, Shanta.
I'll say identify the one thing that you want to change that's
Mhm.
most important to you and take one step each day towards that. And if you miss a day, oh, there's always tomorrow.
Mhm. Mhm. Well, I think I will follow up with that. If you are, or if anyone in your family or your immediate circle of loved ones is living with a particular condition, whether it's diabetes or hypertension or whatever the case may be, get educated in that area. Try to find out for yourself as well as for the person who may be living with the condition, because we're living more and more with these conditions. They're no longer necessarily terminal, they may be chronic. How can you be of support to that person by information, internet, people that are in healthcare, your pharmacist, your nurse practitioner, physician assistant. Go to somebody that you trust that has the right information about that particular area that you want to address and be a support for yourself or for someone else. Self-education.
Self-education. And if you need help with that, y'all know how to find me, Ricky at touchbbca.org.
There you go.
And we'll call somebody. Monique Mo will know. I'll call her anytime, day or night, and say, help me.
Absolutely. We're getting some good feedback in the chat.
We
Somebody
are.
said make better food
choices.
choices daily.
Food
Get
choices,
more
right.
rest.
That's
Yes.
me.
Yeah.
Yeah.
So
I'm on to
yes.
get more rest. And that's why I
more-
say, that's why I
Amen.
said, choose that one thing that you know. Because
Yeah.
guess
Yeah.
what? This person, you see her in the mirror every single day. You got to live with her every single day. You wake up with her bones popping and locking every single morning. So find that thing, that one thing that's
One
most
thing.
important for you.
Yeah.
Yes,
Yeah.
indeed.
Get more rest, find balance. We got all the things, but it all boils down to self-love. Love yourself.
Yes.
Self-love.
Take care of yourself. Handle yourself with care.
Guilt and
My new-
self-judgment.
Handle yourself with
Yes.
care. Handle yourself with care.
And although it's become highly politicized, I'm going to use the term stay woke.
Stay woke.
Stay stay conscious. I mean, it's been turned in many different ways, but what it means is be vigilant, be conscious, listen to your body, and make sure you respond accordingly. Don't delay if
Don't
something
delay.
is not quite right. Don't delay. Just
Don't
check it out
delay.
as soon as you can, and hopefully that'll give you more prognosis is better for even managing it or perhaps even a cure. But stay woke, be vigilant.
Yes.
Got one body.
One body, one life, right?
That's it. That's it.
Yes.
And honor that body. Give yourself space and grace, and I got
Yes.
that from Condi Montgomery. She says space and grace.
Space
This
and
body,
grace.
whatever you think about it,
I
right?
love that.
Every part, every disease, every surgery, everything that
Right.
you needed to get through, it got through to get you to today.
That's
Right?
Yes.
And speaking life over that body, saying sweet things about that body, and
Indeed.
turning off the
Yes.
soundtrack of negativity about that body is something that we
Yes.
need to
Yes.
actively practice, because there's always
Yes.
something negative. And you walk by the mirror and we tell people to love themselves after cancer. You didn't love your body before cancer.
There you
Right?
go.
And
There you
now
go.
you got, other things that we pick ourselves apart. So maybe
Yes.
this month, right? Maybe we don't
Yes.
pick ourselves apart.
And look, and we living in a society where we're constantly devalued as people.
Right,
You
right.
don't count, or you're not worthy,
Right.
and that self-esteem becomes damaged. And you keep hearing that every day, you start believing that nonsense. And that
Mhm.
will affect you physically as well. And if it's exercise, you may not be afford to join a gym, but walk.
Walk. I
Once a
tell everybody,
day.
take a walk.
Yeah,
Mhm.
Walk. Get a dog, take a walk. But
that's it.
and
That's it.
stop listening to the voices in your head.
And yeah, exactly.
I was like,
You
stop.
know, you
Self-talk.
deserve, right?
Yeah. Stop
Just
listening.
remember that this voice is the voice you hear more than any other voice.
Yes. And we're hard on ourselves.
Yeah.
Always trying to do better. We always got to overachieve. Twice as good to get half as far, in society, because we're not considered worthy. And you've got to overachieve, and that's stressful. And that takes its toll on us physically as well. So, be self-care, self-love. You are worthy.
Your
Yeah.
peace is non-negotiable. And
You
your peace is
deserve
non-negotiable.
joy. Again, Ricky, put that in the chat.
Your peace is non-negotiable. And
And that
Yeah.
you are beautifully and wonderfully made.
Made. Absolutely. Amen.
Mhm.
your
Amen.
body is a temple, and you are
Temple.
beautifully and wonderfully made. Wow.
Thank you all for the engagement and for the feedback here. It goes a long way when you share this show. I think that things, tangible things you can take away today. That for this National Minority Health really enlightening show that blessed spirit. So we ask that you tag friends and share it on your social networks, because it can maybe bless somebody else too.
Yes.
How can people reach you, follow you, and on social media or in real life, I suppose? More social media, I suspect, but if people wanted to kind of follow along with the things that you are doing and the platform that you have, how can they do
Come
that?
through me if you want, and I'll connect you.
Yeah, that'll be good to go through Ricky. Yeah.
Yeah, come review me, and I'll connect you to these lovelies. Y'all
Yeah,
know how to-
I'm restarting my podcast in a couple of months, and it's Healthcare in a Diverse America, from molecule to market. You got
You're starting it soon. Let us know when.
Yes, it's usually the last Thursday of the month, and I'm starting it back up in May. I took a hiatus because of all the external
Yeah.
dismantling and elimination of DEI, I wanted to kind of take a step back and really come back forward with some tangible things, like Dr. Mo said, that we can do. Okay, and
All
from
right, so let us
solid-
know because we'll post about it.
Okay, I definitely will. And I
So let us
only
know.
have healthcare professionals and survivors of color, because we're
Beautiful.
rarely sought with respect to how we think and feel and what we've experienced. And I've gotten very good feedback from it. So clearly, I think it's an opportunity for us to show the resilience and courage that our people have demonstrated for centuries, in spite of all the barriers and challenges that we face. So we
Right.
can do this, and we have been doing it.
That's right. We're not new to this. We true to this.
Been around this block a few times, huh?
Yep, yep.
Well, we hope relatable and reliable and real. That's what we do every Wednesday night here on blackdoctor.org. And
We
we're
do indeed.
grateful for the platform every Wednesday at 6 p.m. Eastern time. Thank you all for joining us, for blessing us with your wisdom and your words and your community building, right? This is nation building.
It is.
In it.
It is.
And making sure that we're taking everybody with us this time, because
Yeah.
it's tough with health inequity. So,
That's exactly
know,
right.
Like I said, like our ancestors said, the revolution will not
Not
be
be televised.
televised.
There you
Will not
go.
be televised. I love it.
Amen.
I love what you said
Amen.
earlier too. Maya said it right. When we know better, we do better.
We do better.
Yeah,
That's
we
right.
do
Right.
better.
So also, you know, we're having our 5th anniversary on May 3rd and 4th, and both y'all need to come to DC
Oh, nice.
and
Okay.
come to our
I'm so
party.
mad I'm missing it.
I
All the
know,
breast surgeons are at our national
I
conference.
know, but we're gonna
Oh.
be jamming. We having a gospel brunch, a dance competition, all kinds of good stuff. So I put that link in the chat. Everybody,
Nice.
you know, just click on the link and get some
Right.
tickets. Blessies are, you know, can come for free. Hopefully we'll make you lots of free tickets for Blessies, and we are gonna be dancing all night. It's called
Celebration.
in our shoes.
Absolutely.
Walk in our
Yes.
shoes. We have 5 years of shoes to walk in.
Love it.
That's
Love it.
right.
So
Love it.
Haley thinks she's gonna
Cheers to
take all
5
my pink shoes out of my closet and make tables things out of them. I'm like, what?
All right.
Thank you, Black Doctor. Thank you to our
Mhm.
sponsors. Thank you to you, lovelies. You know I love you
Thank
so
you. Thank you.
Love you
Love
all.
you
Love you
more.
all. Take
And
good
God
care.
bless
Yes.
you. So
Be
happy.
safe. Stay well. Bye-bye.
Stay well.
Bye.
Bless you, love. Bless
Right.
you. Bye.
Yeah.
Bye. Love you, Mo.
Love you too.
Bye.